Hello, Dr. Sutherland, and welcome to the Parkinson's Expo.
Hi.
I want to take this opportunity on behalf of Neuro Challenge to thank you for being involved in every expo we have planned and for your continued support and dedication to our mission. We're very excited for this presentation today on the basics of Parkinson's and the importance of exercise on motor symptom management. Dr. Dean Sutherland is a board-certified neurologist specializing in Parkinson's disease and movement disorders with First Physicians Group of Sarasota Memorial Healthcare System in Sarasota, Florida. Please refer to the Expo program for his full biography. And without further delay, Dr. Sutherland, welcome.
Hi, April. Thank you so much for inviting me to speak today. What I'm going to talk about is the basics of Parkinson's, and then we'll go into some of the ways that exercise tends to help with motor symptom management. So you'll see that there's a lot of good information that's out there that patients may not know yet, in terms of what exercise actually does for you. So I think this will be an exciting talk and maybe motivating, hopefully, for a lot of people as well. So let's talk about that. So we're going to go through, again, the basics and what Parkinson's looks like, what the symptoms of Parkinson's are. We'll talk about why you should exercise. And importantly, I think from a lot of people's perspective is what is the evidence that it actually helps? And what type of exercise does help? We'll talk about ways that we have formalized exercise programs. We'll talk about rehabilitation programs, PT/OT, speech therapy, things like that. And we'll talk about how to coordinate your Parkinson's medication and your exercise at the same time. So this is sort of a basic review of Parkinson's. This is a picture of Michael J. Fox, as you know, very famous and wonderful fundraiser for Parkinson's organizations, who has here a picture of him with his face being kind of what we call a blank face or a poker face. That's something we typically will tend to see in early Parkinson's and later on as well. Voice becomes soft. People tend to have difficulty with walking. Their feet will stick to the floor, and we call that freezing of gait. So it's a very common term that people should know about, freezing of gait. Posture tends to become stooped over or hunched, as we say. People tend to have falls, and those falls can be either when they're outside on the sidewalk or in their yard because of the uneven ground, or they happen when they're just standing at the sink and trying to turn around. Eye movements can be restricted and kind of also cause problems with people balance and falling down as well. Posture also affects the hands, and in this picture you can see Michael J. Fox's hands are kind of bent, and that's called tenting, and that tends to happen usually in one arm or hand before it happens on the other hand. This can also be associated with something called dystonia, which is cramping of the hands or feet. Handwriting tends to get very small, and you can see here's a picture of someone's handwriting. It says, "My leg is feeling better," I think is what it says. But this is called micrographia. Handwriting starts out larger and then gets smaller and smaller and smaller as we go along. So those are the things that people see on the outside of Parkinson's. So say if you were in the mall, someone might notice that you have Parkinson's just by looking at your physical symptoms. There's a lot of things that go on underneath the surface in Parkinson's, though. We call those non-motor symptoms. And in many ways, these may be more debilitating than the motor signs and symptoms. So again, the motor aspect is the physical aspect you see, and the non-motor are the things that are underneath the surface. So some neurologists would say that even 90% of Parkinson's actually is what goes on underneath the surface that you don't see on the outside. The things that we tend to see in terms of psychiatric manifestations are things like depression, which is very common. Maybe 30 to 50% of people with Parkinson's get depression. Apathy, which is not really having an opinion or caring about going out to do things. Cognitive impairment, which is kind of like an early dementia symptom. Memory loss, hallucinations, dementia, those things all can go along with Parkinson's. Sleep problems, the main one that we see is called REM, sleep disorder, where people have difficulty with body movements in the middle of sleep. So normally your body is supposed to be shut down in the middle of sleep so you don't sleepwalk and jump out of bed. And in REM sleep disorder, that part of the brain is not working due to Parkinson's, and people tend to have extra movements and they thrash around at night or talk in their sleep and have very wild, vivid dreams. Lack of sense of smell, which is called anosmia here on the bottom, is very common. Maybe 90 to 95% of Parkinson's patients experience that, sometimes many years before they get Parkinson's symptoms on the outside. There's other issues that we know will happen as well, something we call autonomic dysfunction. So the autonomic nervous system controls a lot of automatic sort of things in your body, like blood pressure and heart rate, your ability to produce saliva, sweating, things like that. So in Parkinson's, it's very common to have those parts of the brain also misfunctioning. Those are the parts that are controlling your sweating and your heart rate. People who have drooling often, becomes a sometimes debilitating problem. Sweating episodes can happen at any time of day or even in the middle of the night. We know that heart rate can become affected, so that when you get up from a chair and go to answer the door, you might have a low blood pressure because your heart rate doesn't respond appropriately, and that's called orthostatic hypotension. A lot of patients, probably another 80 to 90% of people with Parkinson's, will develop significant constipation and a slow stomach emptying. So this is called gastroparesis, when people have slow stomach emptying, and that happens around 30 to 40% of the time as well. So these things are all very common in Parkinson's. And then erectile dysfunction is also quite common as well as part of the autonomic nervous system. A lot of people come in and they want to know what their stage of Parkinson's is. And sometimes it's useful to know that in terms of thinking about what your prognosis might be. Oftentimes it's more a manifestation of being very anxious about where you are and what's going to happen to you. But we do have different ways of staging Parkinson's. The one that's probably used the most in research and sometimes in individual patient reports is called the Hoehn and Yahr stage. So doctors Hoehn and Yahr made up this staging system back in the 60s, and that it starts out with stage 1 being only on one side of the body, for instance, a tremor in one hand. And then once it gets to both sides of the body or both hands have a tremor, and then it's at stage 2. When you start to have some balance problems, we call it stage 2.5. And then when you really have walking issues and balance problems, then it becomes a 3. If you have to have a cane or a walker to get around, then we say you're stage 4. And if you cannot walk on your own at all, then we call that stage 5. I also often refer to people as being mild, moderate, or severe Parkinson's disease. Another way to look at it is early Parkinson's, mid-stage, or late-stage Parkinson's disease. And these categories can be helpful more in terms of research purposes, or when you're talking to another doctor about someone's Parkinson's. They can sometimes be used to develop a prognosis, but as we'll see in a minute, everyone's progress is sort of individualized and occurs over the course of a very long time. So this is a slide that shows us the phases of Parkinson's disease. And I like this slide because what it shows is that this red line here on the left, that starts at the top and goes down, that is the loss, that represents the loss of dopamine neurons in the brain. So dopamine is the neurotransmitter that is important for Parkinson's. If you don't make enough dopamine, you can get Parkinson's disease symptoms. And that's exactly what happens in classic Parkinson's disease. But it takes a few years here. So from the onset of this red line starting to come down, all these little dopamine cells kind of getting picked off over time, eventually then you will develop motor symptoms. So the motor symptoms in the premotor, or excuse me, the non-motor symptoms we talked about before with psychiatric disturbances and things like that, tend to kind of start around the same time, with the proviso that some of the sleep problems and problems with sense of smell can happen a few years earlier than the actual motor symptoms of having tremor and walking imbalance problems. And then as those cells continue to get picked off over time, these motor and non-motor symptoms tend to show up more. And we call that the motor phase of Parkinson's. This time course for years is anywhere from basically 5 to 30 years. So What we do know is that different people have different rates of progression of Parkinson's. And we think that's also due, in fact, probably to different rates of cell loss in Parkinson's. So it may take someone 5 years to progress to severe loss of their dopamine cells, or again, it may take them 30 years. And everyone's a little bit different with the disease process. A lot of people also kind of want to know how long they've had Parkinson's. This graph is really nice. Dr. Lang and his associates, showing that constipation can happen 20 years before you even start to have motor symptoms. REM sleep problems we talked about can happen up to 10 years ahead of time. Problems with erectile dysfunction and sense of smell and depression can then come on years ahead of time. But eventually when the motor symptoms start, then people begin to have more of the classic sort of symptoms. But the thing that we also see coming in here about year 10 to 20 is cognitive symptoms with dementia. All these other symptoms tend to continue to progress. So a lot of patients want to know if there's some way that they can halt their symptoms or be asymptomatic. I don't think that we're talking about curing Parkinson's disease when I talk to these patients, but more about how they can slow it down. And as you'll see in a minute, I think exercise has a significant role there. So again, everybody with Parkinson's, probably each person is an individual with it, and we call it a boutique disease for this reason. So a boutique disease means you have a little bit of column A, a little bit of column B, a little bit of column C, and different people have different amounts of that, and different people have different rates of progression. So I often have patients that come in that say, oh, I know a guy down the street and he got Parkinson's and he got really bad and he was gone in 3 years. Well, number one, that's unusual, but number two, that's also an individual person. On average, Parkinson's tend to progress very slowly. Without any treatment, without any medications, without any exercise, it probably takes about up to 2 years to go from stage 1 to stage 2 to stage 3 to stage 4. Each of those takes at least 2 years with treatment. And by that, I mean not only medication, but also with exercise. It probably takes 2 to 4 years to go from one stage to the next. This is a picture, which is kind of a classic picture of what happens in Parkinson's disease. So on the left, there's a nice slide of some sections of brain from someone who had Parkinson's disease and from someone who is normal on top here. So the patient with Parkinson's on the bottom, they've lost this black area. It's called the substantia nigra. Those are the cells that make dopamine in the brain. So even without any sort of special preparation on pathology, any stains or anything, brains of Parkinson's disease patients show that they've lost that ability to produce dopamine very clearly. Now, when that happens, also along with that, there are proteins that build up inside the cell, and that's called alpha-synuclein, and that's related to the loss of the dopamine cells. When that protein builds up, you get these globs of protein that are referred to as a Lewy body. So you see this word down here, Lewy body. So Lewy bodies are seen in normal older brains occasionally. They're seen in other conditions. They're seen a lot in Parkinson's and a lot in a condition called Lewy body dementia. So Lewy bodies are common in Parkinson's. If someone tells you you have Lewy bodies, it doesn't mean you have Lewy body dementia. It means that you have those little globs of protein in the cell. Again, very common. So Parkinson's patients just in general tend to be less active. They're a third less active than people that don't have Parkinson's. And as you can see, that leads to muscle loss. People get weak. They have more difficulty with exercise tolerance. People who used to take a 5-mile walk can only do a 1-mile walk. And that, as the disease progresses, starts to become more and more obvious. Along with this, because of being less active, people tend to lose bone mass, and they get things called osteopenia and osteoporosis. So those two problems are, osteoporosis being the worst of those. Those are things that need to be tested for and treated by your primary doctor. People tend to lose weight. That's one of the hallmarks. Untreated Parkinson's patients lose weight precipitously. In other words, very quickly. Depression, as I mentioned, happens in 30 to 50% of Parkinson's patients. And just as an aside, also in their caregivers, 30 to 50%. So very important to know that. People with Parkinson's tend to be more withdrawn also. They're not out doing things with their friends. They tend to not go to social gatherings and parties and things like that because their voice becomes softer. and they often have kind of a delayed response time, and it gets harder for them to feel like they're included in the crowd and part of the crowd. And then also some people, of course, get nervous about other people seeing their tremor and noting that they might have Parkinson's disease. So what if I told you, as a patient or as a caregiver, that you could actually live longer, that you could be stronger, and you could be less afraid of what's going on in the future? Of course, you'd say, well, gosh, yes, please tell me how to do that. I mean, you can see where this is leading, right? You know what I'm going to say. And also, it's something non-toxic. It's something that can make you smarter, and you have a choice whether or not to take this on and to do it. Of course, we're going to talk about exercise, of course, because we know that it works. And I'll give you some data in a little bit here. This is one of my little sayings that I like, because it's absolutely true. Being sedentary is like taking poison for Parkinson's disease. You cannot be sedentary. You cannot sit on your duff at home. You have to be out there exercising and doing something. I say every day. A lot of times I'll let somebody get away with 6 days a week and begrudgingly 5 days a week. But it's very important that they're out there doing something every day. So again, why should you exercise? Well, we know that it will, and there's evidence to support these things that I'm going to talk about. It will improve your balance. It reduces your risk of falling, which I will tell you is a very large problem in Parkinson's in terms of severe injuries, either head injuries, broken hips, broken ribs, things like that. But interestingly, and there's really good evidence for this, it improves cognition in people with Parkinson's. So your thought processes can get faster, and you have more mental clarity. We know that despite, say, just for instance, you're 72 and you have Parkinson's, you can improve your endurance, you can improve your strength. When you do these things, you also can improve your bone mass, or at least maintain it. And then we also see that as Parkinson's progresses, as I mentioned, some people feel less confident about getting in crowds and going out to do things. That confidence can be improved by exercising as well. So it does tend to slow the physical effects of Parkinson's disease itself. Interestingly, people who exercise are at lower risk for getting Parkinson's in the first place. So that shows us something right there. So if everyone's exposed to the same sort of chemicals on average, or large population studies looking at that, and we see that people who exercise are less likely to get Parkinson's, then that's pretty strong evidence in and of itself. So there have been many, many studies of exercise for Parkinson's. We've looked at walking, weightlifting, Tai Chi, yoga, Qigong, tango, ballroom dancing, Dance for Parkinson's, which is a special program for Parkinson's, spinning on bikes indoors, water aerobics. So these are just a few of the things that have been studied. I would say basically anything you could think about off the top of your head has been studied for Parkinson's disease. And almost all of them, at least at some point, have been shown to work. The reason I bring that up is because a lot of people ask me, what's the best exercise for Parkinson's? And I think we all kind of figured out that the best exercise is something that you like to do, that you will do. Again, being sedentary is the worst. So if you would rather go out and take a walk around the park, or get on your spinning bike at home, or do some yoga on the floor at home, or get into your pool for 30 minutes, anything that you can do is better than doing nothing. There was a study that was done a while back by the National Parkinson's Foundation, which is now called Parkinsons.org. And they, Parkinson's Foundation rather, Parkinson's Foundation sponsored this study. They started in 2009. They had 12,000 patients involved in this. And these were people who had early Parkinson's, late Parkinson's. They were ranging in age from, I think, 18 years old to in the 90s. Very large study, and they looked at many different aspects of Parkinson's. They looked at a lot of things in this study, including medications, deep brain stimulation. They looked at funny body movements called dyskinesias. They looked at brain function in terms of cognition. One of the things that they found in the study was that people who exercise, both people who had not been exercising or who were already exercising, had a better quality of life and better mobility. On average, those people who showed those improvements in their quality of life with Parkinson's were exercising for about 2.5 hours at least per week. So that's important that you know that. So if you can imagine yourself exercising for half hour, 5 days a week, then that's where that kind of fits in. We would love for you to do 30 or 40 minutes if possible, and as I mentioned, 5, 6, 7 days a week. You don't have to kill yourself. You don't have to go out and run a marathon. In fact, there was one interesting aspect of one of these studies that showed that people who do go out and run marathons and who do exercise extremely hard to try to treat their Parkinson's, that some of them actually are doing themselves a disservice and then become weaker faster. So moderate exercise, we think, is probably the right way to do Parkinson's. You have to push yourself a little bit, but not to the point where you're doing 2 or 3 hours of exercise per day. It's actually probably detrimental in the long run. This is one example. This was a nice study with walking that was done with Parkinson's in 2014. 48 patients involved in this. These patients were told to walk 3 times a week for 45 minutes, and they were followed over 2 years. So when we looked at the actual measurements of things that we were looking at with Parkinson's, what we found was that their maximum oxygen consumption, in other words, how much the heart can handle in terms of blood flow, was improved. Walking speed or gait speed, gait is walking, that was improved. There's a motor score that we do in our office looking at different aspects of Parkinson's with fine motor movements and tremor and balance and walking. That test is called the UPDRS test, and you'll probably hear that test mentioned many times if you listen to people talk about Parkinson's. It's a test that's standardized, and we use it to measure how a patient is doing, mainly for research studies, but also sometimes to help with figuring out things like deep brain stimulation, et cetera. There were improvements in fatigue. People were less depressed, and again, this quality of life, which are various scales of finding out how people feel like they're doing. The quality of life scores were better as well in this study. So again, this is just one example out of hundreds of them showing that walking is good enough for Parkinson's to help out. Formalized exercise programs that we know about. There is Rock Steady Boxing, you can see right here. That is a program that was started many years ago that has now spread all over the nation. We have many programs in the Sarasota area for Rock Steady Boxing. And it's not actually so much boxing. In other words, patients are not boxing each other, but they are boxing on bags. But it's also more like a station training sort of situation where you box on a bag a little bit, and you move over to another station where you do a little bit of jogging or you do some stepping, working on your balance, and you go to another station. It's a lot of fun. People really enjoy it. Another thing that we have seen that's been helpful is pedaling for Parkinson's. I think I misspelled pedaling here. They're not selling things. They're getting on a bicycle and pedaling their bikes. So that's actually been and is now national programs through the YMCA for that. It's taken off like crazy. People really enjoy it and do well with it. At our program called Health Fit, which is out on Clark Road in Sarasota, we have a program called Whopping Movers, which is a Parkinson's exercise class. There are other Parkinson's exercise classes all up and down the coast that we know about. So if you can get involved in one, a lot of people find that they do better when they're in a group because it's more motivating. It's easier than trying to do it on your own at home. Dance for Parkinson's is a national program that was started in New York and is very successful, and people really enjoy it, and it definitely works to help reduce their symptoms. Yoga has been shown to be helpful, and there is a yoga program in Sarasota that's available called Pineapple Yoga. Ballet through the Sarasota Ballet has helped Neuro Challenge Foundation set up ballet. There are lots of things that are available. At the top, I didn't mention LSVT Big because I'm going to talk about that in just a minute. So LSVT Big is a program which is specifically designed for exercise with people with Parkinson's. So the LS means Lee Silverman, it's someone's name, and then VT is voice training. So originally this was started as a voice program to help you improve your voice volume. And then those sort of principles were then taken into the arena of physical activity, and that's called BIG. So that's done with a physical therapist. And the physical therapist trains you to do a rigorous prescribed exercise plan at home that absolutely helps to reduce falls. It helps with mobility. And it's something that you can do with just 15, 20 minutes at home every day if you can do it. It's a wonderful program. So again, this was created, it's called Lee Silverman Voice Training, was the original routine that was worked out. Big therapy was created later. During these during the training, you have to do these really large movements of walking and stepping and moving with your arms. And it helps because Parkinson's patients tend to underdo things in terms of their physical ability. They tend to have small steps. They tend to underreach. They tend to have soft speech. Those things are all worked on. This reduces fall risk. And when we actually looked at these different motor scores, as I was talking about earlier, as well as some other physical therapy scores here, a 2018 study with 114 patients doing LSVT big saw 40 to 50% improvement in some of these measures. So quite a useful program. And here's some pictures of this young lady doing training people how to do LSVT big movements. So they do this one-on-one with you. This is a one-on-one program, although there are some classes that are based on this where you can take it with other patients, like the Whopping Movers class. So LSVT big, that's something your doctor can prescribe for you. And here's a group exercise with LSVT big. Once you're done with this, it's hard, as I said, it's hard to keep up with these sort of things at home. You know, it's human nature. People tend to go to these classes and they do wonderfully, and they go home and they're very happy with it. And then week one, they're doing they're gung-ho. Week two, they're pretty gung-ho. Week three, they're not quite so gung-ho. So as your enthusiasm may wane, which is normal, if you use these homework helpers that you can actually get from LSVT big, they're DVDs that you can watch and you can do it with them. And I can guarantee you, if you keep up with that, if you get some of those DVDs and you do it at home, you'll keep up with it. I've seen that before, and it's definitely helpful. A new program that has developed that we now offer, at least in Sarasota, as well as some other places, is called PWR, or POWER, Parkinson's Wellness Recovery. That's also a similar program based off of physical therapy training to train you to help yourself at home. Along with that, as we mentioned, LSVT Loud. So LSVT Loud is the Lee Silverman Voice Training Loud program. So this graph sort of shows someone trying to speak or to shout loudly. People with Parkinson's just do not speak loudly, even when they think they are. They think they're yelling, but they're really not. And as a result of that, they have to kind of be taught how to do this. So Lee Silverman Voice Training helps people to be able to project their voice and to speak with intent, to allow them to communicate better with their family members and people out in public. So before LSVT Loud, you see this person on the left here is kind of this hunched posture, and they're producing a very small amount of volume of sound. Lee Silverman training helps you to expand those lungs, straighten up the posture, and project that voice out so that you can hear, so that people can hear you much better. Again, there's a DVD that goes along with this, so so you have no excuse. You have to keep doing it. Okay, so if you go to the LSVT global website, you can put in your zip code and you can find out exactly somebody in the area that can help provide you with those sort of training. But you have to get the prescription from a doctor. So that brings me to my next point. You have to do these exercises at home. You have to do them. And exercise is medicine, and that's something that I'll show you in just a minute here. Rock Steady Boxing, as I mentioned, available multiple places. This was actually a slide I put together a couple of years ago, so I know there's even more of those out there now. So you have to you can find those through your local Parkinson's Foundation, or through Sarasota, through Neuro Challenge Foundation, or in Sarasota also. There are numerous ones going on. Boxing for Parkinson's does work. We know that. We have a study that was done in 2013 with 31 patients, again, showing that boxing improves balance, improves mobility, and quality of life. So here's Betty working on one of those boxing bags and thinking about her mother-in-law. So she's trying to get motivated. Okay, again, Rock Steady Boxing is the way to go with that. They have great programs all around. Pedaling for Parkinson's, as I mentioned, it started by Jay Alberts at Cleveland Clinic in Cleveland, and he has a national program through the YMCA's that have helped to adopt spinning programs all over the place. We have very good ones here in Sarasota, and it can be very helpful. Here's some of my favorite patients here, all doing pedaling. And so this slide, obviously from 2 or 3 years ago before COVID, and just pedaling was kind of online for a while. I think now things hopefully might be opening back up, and we might see more of these classes becoming in person again. I'm certainly hopeful that's going to be the way things are going. Exercise, as I mentioned, reduces your risk of getting Parkinson's disease. I'm not going to belabor this slide too much, other than to say that if you have risk factors for Parkinson's, sense of smell has been lost, you have REM sleep disorder, your constipation is unexplained, your risk of getting Parkinson's can be 60 to 65%. So what could you do, or what could you do in the middle of your life or when you're younger to help delay or even maybe stop that from happening? Exercise significantly lowers your risk of getting Parkinson's. So this is what we call a p-value here. And this p-value is 0.009, which means that it's a very significant reduction in your likelihood of getting Parkinson's. So when Parkinson's is treated properly, and by that I mean medications, exercise, you may be able to slow down the progress of Parkinson's. I don't think that we're talking about saving brain cells so much, although there is some evidence for that. But it looks like without treatment, you have about 8 to 10 years with Parkinson's before you get very debilitated. And with treatment, it's more like 15 to 20 years. Again, proper treatment to me means both of those aspects, as well as other things, but exercise and the proper medicine. As I said before, it improves your memory, your cognition. So this is a study that was done in 2018 with 14 patients looking at high intensity training, interval training, and memory was absolutely improved after moderate exercise with this program. There's another study in 2019 looking at all the different studies that people could find. And with 500 patients, again, we found that people had improved cognition. It also helped balance. Sleep is better when people are exercising. There was another study recently that looked at 15 different articles on sleep and Parkinson's, and exercise was significant in improving that and also reducing that REM sleep disorder problem we talked about. So what does exercise do to the brain? Well, it makes you make your own dopamine. Your own dopamine that you're already making in your brain gets produced more efficiently. It also produces these things we call neurotrophic factors, which are things that help your brain cells connect with each other and grow, so you form new connections. It also produces endorphins, which are things that help reduce pain. So these are medicines that you normally can take. You can take dopamine orally. You can take things that improve your neurotrophic factors. You can take pain medications. Well, exercise does exactly this. So exercise is medicine for people with Parkinson's. We also know that the dopamine production that's in the brain seems to be sustained. In other words, it's not just something that happens for 20 minutes, but there's evidence that it can go on longer, lasting several days. This slide is just looking and comparing what might happen if you were exercising versus not. So this red line here indicates someone, again, progressing in terms of their dopamine cell loss. The dotted line is where we think that you should be if you're an exerciser and you're doing things to prevent yourself from getting worse. Very important. This is a slide, again, looking at what happens with the dopamine production here. So over here on the left, there's a neuron it's got dopamine going on to this other cell. And these trophic factors are things that increase the connections between the cells that you want to preserve those connections and even increase them. So exercise helps with that. On the left, here's a brain of someone just sitting quietly. And then on the right is someone exercising, walking. So this person walked for 20 minutes and they were triggering endorphins. We see the same thing with dopamine. When you're exercising, we can do live scans, which are very hard to do, but they do show that people's dopamine gets produced more efficiently. What's the best exercise? Again, we don't know what the best exercise is. It's anything that you can do that you'll enjoy. That's my take on it. If you like to do something, do it. Tai Chi, here's another study that's been shown to be helpful with gait, balance, motor scores. This is a large study of 195 patients. We could go on, and I could again show you 100 different studies like this, but they all show that exercise helps. So the long and the short of it is exercise is as important as any medication you can take for Parkinson's. You go to different talks about Parkinson's around the nation, you will hear everyone say this. This is the way it is. Exercise is as important as any medication you can take for Parkinson's. Just a couple of comments here. So we know that when people take Parkinson's medications, their blood level of dopamine that you're taking orally in the carbidopa-levodopa pills goes up and down. So when that goes up to its maximum is when you're probably going to have your best exercise. So we try to tell people to time their exercise at the point when their dopamine level is at the maximum. So it might be 30 minutes or an hour after you take your carbidopa-levodopa that you probably should be exercising. And here's another little way to look at that. So in between these pills, you get some people get off time, which is where the medications are not quite working as well. So this blue trough is where it's off, and then you take a dose and your levels go back up and it goes back down. So what we want to do is to keep your dopamine level up while you're exercising. So you take your pill and then you exercise. In other words, you may be exercising if you're off your pill, and you may find it goes out of your body quicker and your exercise is less effective. So you should time your medications to be 30 minutes to an hour before you exercise so that you get that best on time. So again, try to time the medications. Try to avoid exercising when you know you're going to be off, because you're going to have a terrible exercise session. You're not going to feel good. Exercise burns up your Parkinson's medications faster. Take them before your exercise and not afterwards. Try to make sure you have lots of water on board and electrolytes so you don't get lightheaded. Figure out your best time of day to exercise. Don't just exercise randomly. Try to figure out if it's 10 a.m. or 2 p.m. or or 6 or 8 p.m. Whatever works best for you. If you can get a trainer or a physical therapist. Talk to them about your medications if you're working with one already. And they also may be able to help you figure out what the best time is for you to exercise. So here's what I say: be a Parkinson's smarty. Being sedentary is like taking poison for Parkinson's. You have to do the exercises at home, and exercise is medicine. Thank you.
Thank you, Dr. Sutherland. That was a very informative presentation.